like that, mentioning my love of Lycra. I was, of course, considering delivering this presentation in my tri-suit, but I thought the vision would be too horrific for everyone concerned. I was, of course, going to keep the half Ironman a secret, but I'm secretly delighted that everyone knows. But I'm also really, really genuinely honoured to be invited to speak here. This is by far my favourite conference. It's been excellent every time it's been held, and I think provides a really strong forum for people who are genuinely interested in the public health aspects of physical activity. You know, we've got loads of sports science and physical activity conferences and lots of opportunities to mix with sort of various sections, but I really feel as if this conference brings everyone together. So I love to come, and to come to Australia is the cherry on the cake, so that's been great. And thank you also for that sort of personal introduction, because I think my weird checkered career history is relevant to what I'm going to hope to say over the next few minutes. Because, as the slide says, I'm kind of a bit of a mixture. I have an unpaid academic position, an honorary position at the University of Oxford, but I run a private consultancy company delivering research and consultancy to anyone who wants it, basically, but mainly to government departments and government agencies, mainly on physical activity, but also on active transport. And what it means is that I've kind of spanned the academic and practice disciplines, if you like, and I sit pretty much in the middle, so I'm really, really interested in the application of evidence into policy and evidence into practice. And I've kind of been at the very mucky end of seeing government policy produced. So I worked in the Department of Health for a while and the Department of Transport. And one horrific time in my life, I worked in both at the same time. And I had two sets of ministers to report to, two different agendas, and I had two different sets of things to think about whilst trying to bring together health and transport. But it's really this application of evidence into practice that I find particularly interesting. And I think, you know, it's particularly challenging for those of us who are focused researchers and do good research, but sometimes think, well, you know, where's this actually going? So what I'm going to talk about is the notion of evidence-based policy. I'm going to start by thinking about evidence-based policy and why we should be concerned with evidence-based policy. We'll look at what policy actually is. I'm then going to move on to look at how evidence has been used to implement policies on physical activity. And that was my initial brief, really, when Wendy and Adrian contacted me. It was kind of a state-of-the-art, you know, how are we doing with actually getting evidence into practice? And then I'm going to go on to expand really on some excellent presentations that I've seen over the last couple of days, particularly from Billy Giles Cortai and Ross Branson, on kind of, well, what do we do about it? What evidence do policymakers actually need if we're going to get this into practice? And I'd also, just before I kick off, like to say, you know, so much of this thinking has been inspired by a number of colleagues in the room, particularly Adrian, who over the years has really got me thinking about this whole area and really helped me to think about applying experiences into a sort of more academic format. But, you know, why should we bother about policy? Who cares about policy? Why should we try to focus our efforts on policy? Well, here's one reason why. Anybody know where this is? This slide was shown at the pre-conference satellite symposium. Anyone recognise this place? Anyone been to the border between Belgium and the Netherlands? And what do you notice about a few things that change as you drive from Belgium here across into the Netherlands? Isn't this an amazingly stark application of why and how government policy can influence the place in which we live and make decisions about our health? As you drive across this clear border here and leave Belgium into the Netherlands, the transport infrastructure changes. In the Netherlands, they're so keen on bike lanes that it eats into the car lane. So you can see even this car is having to drive across the bike lane. But clearly, a policy decision has been made to prioritise cycling. This is quite a rural area, very different from in Amsterdam, where you see segregated areas, and these would be curbs. But a clear policy decision has been made to prioritise cycling and really to limit the amount of land that's given over to the car. But you know, it's not all good. If you look here in Belgium, the pavements, the sidewalks or pavements are better, and actually you can see there's not brilliant provision in this rural area for pedestrians in the Netherlands. But to me, this is such a stark, the contrast between the two is such a stark explanation of why we should be interested in the sorts of decisions that governments make, the sorts of things that policymakers say they want to see, you know, rolled out across the country. Why should we bother about policy? Well, here's a nice application of social marketing. You probably can't read it. It says 8 guidelines for a healthy diet. Enjoy your food, eat a mixture of fruit and veg, all these things. It's good quality advice from nutritionists put into a poster format to give us advice about what we should do. And where did my friend Harry Rutter, where did he take a picture of this poster? Outside the Burger King. It gets worse. In a National Health Service hospital in Southampton. So some policy had been made, quite rightly, to say, as part of this Ministry of Agriculture, Fisheries and Food campaign to promote healthy eating. So that policy resulted in this poster coming up. But a policy also about the funding for the hospital and how they needed to attract private sector funding meant that instead of a healthy canteen, a Burger King went in to the foyer of this National Health Service, a government-funded hospital. You know, a crazy policy decision, in my opinion. A policy conflict that really reveals a lack of consistency in the application of policy decisions. But this is why policy is important. This is why we should care about policy. Why is policy important? We want to see more bike lanes. We have rolled out 462 kilometres of bike lanes across our town. Yeah, but they're rubbish. What's the point of this? What's the point of a bike lane that rides straight into a tree? And I found this one just yesterday. Isn't this phenomenal? You know, Adrian pointed out I quite like dangerous cycling. Even I wouldn't cycle along there, straight into the canal. And in fact, in the UK we even have a literature on this. Crap cycle lanes, the 50 worst cycle lanes in Britain. But I could do a whole presentation of gratuitous funny slides about bike lanes, and I've got some more later on. But the point is, of course, this shows policy conflict, and this shows inconsistency, particularly between the desired or stated policy, so in this case, we will have X kilometres of bike lanes across our city, and the implementation, where clearly something has gone wrong. And these policy conflicts, I think, are really important and actually really quite interesting. This is my local station, Manchester Piccadilly, and this is the route that you have to take to get to platform 15, which is kind of slightly away from the rest of the concourse. And my wife tells me that when she used to travel across this station, this was kind of, they'd always have to run along here because they'd always be late for their connection. And actually that was the fun bit of their journey. They'd go on holiday with their parents, be going to stay somewhere, and they'd always be missing always be late for the connection, have to run along this little bit of concourse. When the station was redeveloped, a policy decision was taken to put in this travelator. And as a result of this, guess what happens? You know, really, of course there is a choice to be made. Of course you can walk along the side, but you know what happens, and you've seen it here. Most people don't. When presented with the option, most people take the easier choice. And I've shown this a few times, and in a few sort of transport forums, people will complain at my sort of flippant use of these gratuitous images and say, but this is put in place for people with disabilities and for people carrying heavy shopping and needing to get suitcases along and so on. And those are important points, and I think that shows that the conflicts that we can see between policies, and clearly in this case the ease of getting people mechanically to their train was put above giving a more walkable environment in the station. And I think again this shows the potential tensions and the policy conflicts, but it also begins to give us clues about our role. Because I always wonder, when I look at this, if there was a public health person in the room when this decision was made. When the Piccadilly station plans were put up for consultation, was there a public health response? Would you bother? You know, as public health advocates, would you respond to the redevelopment of your local station? You might think, well, it's not that relevant. And the point is, if we miss these opportunities, we can miss the potential to influence these policy decisions that can start to create unfriendly environments for physical activity. This is why policy is important. This is a more consistent approach to an activity creating environment, or an active living creating environment. This is somewhere in Amsterdam, I can't remember where, but you just look at all the elements of a healthy active city. From good bike parking, from merged surfaces that allow bicycles, pedestrians and wheelchairs, still allow a differentiation between the road and the pavement or sidewalk, but also integrated with low speed limits. A very consistent application. So what you ask yourself, what's happened here? Well, I'd suggest what's happened here is policy, again, but a consistent application of policy at a very senior level. So across many of the more active environments, we see people, mayors and so on, saying, no, actually we do want to give priority here in our city or in our country to activity and creating and healthy environments. And we know how to do it. It's not just about walking and cycling. This was in Barcelona where I spotted the outdoor table tennis tables being provided free of charge and readily available. Again, policy, someone has decided the provision of easy-to-use sports facilities is a good public goal. And it's not just about, I don't want to give the impression it's just about kind of creating environments, or building stuff. It's also about how things are maintained and how things are used. This is in Copenhagen, I think, where they have snowplows, especially for the bike lanes. Whatever it is, 1.5 meters wide, and the bike lanes are nearly always cleared before the roads are cleared. So again, a public policy decision was made that we prioritise cyclists so much that when it snows, we're going to give them better treatment than the car drivers. This is my local bike lane in the UK, and you know, that's not what happens. And so in this case, the decision was taken, you know, it's only a few leaves maybe, but this is the sort of thing that is enough to put off learner cyclists from you know, taking the first step and getting on their bikes. So it's about the environment, it's about the maintenance and use of the environment, it's also about fiscal policies. I'll talk a little bit later about the congestion charge in London, but this guy, the reason he's the only person in this lane is because if he was a car, he'd be charged to enter central London. I think it's something like $16. So this is a very courageous fiscal policy that was taken by the Mayor of London and has transformed transport in London. So it's about the environment, it's about use of the environment, fiscal policy, but it's also about social aspects, informational campaigns. You know, policies can influence how we're encouraged to use our environment, and use our facilities. Anybody know what language this is? Wow, quite the Welsh contingent over there, very well done. I thought that would be a tricky question to answer. So someone in the Sports Council for Wales has taken the decision that they want to encourage, you know, active use of the stairs in their facility. But you see time and time again the implications of policy across how we're encouraged to use our environment. You know, don't walk on the grass, don't tread on the flowers. Unlike this sort of thing, Cave Space said, wouldn't it be nice if we saw more, you know, please walk on the grass signs, please play ball games here. And it's interesting to see how policies are sometimes prioritised and decisions taken to allocate kind of put one policy decision before another. So in Barcelona, I would suggest the infrastructure for cycling is not particularly good. It's still a pretty crazy place to cycle, but an absolutely excellent public bike hire scheme that clearly gets over the barrier of people not having bikes available to use. I was in Dubai earlier this year, and really interested to see some of the policy decisions that were taken there to deal with what is really quite a hostile environment to physical activity. It's so hot there that it's extremely difficult to be physically active out of doors. And the traffic conditions don't really support physical activity and walking and cycling. When I asked in the hotel, where can I walk from here, the response was, well, you get a taxi from just outside, that takes you 20 minutes across the town to the walking facility on the beachfront. And so, you know, from one point of view, you think, well, that's terrible. You know, this is such an unfriendly environment for physical activity. You know, why would I have to get a taxi across town? That's what I initially thought. But on the other hand, they've built an extremely high quality, easy to use, and amenable walking and cycling environment that means you can exercise on the beach. So then I asked a really difficult question. Great, now where can I go cycling in Dubai? And they sort of went, that's a bit more tricky, mate. Well, I spoke to a local cyclist, and he said, oh, you go cycling on the autodrome once a week. So the policy decision, you know, I keep emphasising this P word, was taken by the owners of the motor racing circuit in Dubai, that once a week they'll allow cyclists to hare around their racetrack, basically. And it's a fantastic amenity. Again, you could be negative and say, you know, how crazy that we have to cycle away from the road and on a separated facility. But as well as nutters like me training for triathlon, there were families there, kids, all sorts of people pottering around on all sorts of bikes, having a really nice time in a traffic-free environment. And for a motor racing centre manager to make that policy decision to support cycling, I thought was really good, a really, really positive move. So that's why, you know, policy is important. I saw in a couple of pictures from this sort of set. I was really interested to see this off the Sydney Harbour Bridge. Policy decisions to say we're going to encourage people to cycle across our harbour bridge. You know, clearly, not to do so would make access to many parts of the city here extremely difficult. And intrigued to see this kind of central median that's designed for people to push their bikes up. Also intrigued to see that the local challenge seems to be stage 1, can you ride down it? Stage 2, can you ride up it? Yeah. So I want to rent a bike and give that a try, obviously. But what I was also interested to see was at the bottom of the, so just across here, at the bottom of this, was all the local information about cycling. Fun rides, ride to work day, bike maps and so on. So again, a policy decision not just about the environment, because that's only one part of the socio-ecological model, but about information and making it easy for people to get around. So policy is important, and I guess we should just briefly think about what we mean by policy. Typically, we think of policy in terms of law or legislation, and that is, of course, one type of policy. And Ross Brownson this morning gave a fantastic lecture, really emphasising a lot of these aspects. And he talked about the big P and the little p. So big P policy would be kind of government policy, laws, legislation, and so on. But policy is also, as I've kind of shown with all these photos, policy also comes from the decisions that are taken rather less formally, sometimes by organisations. There might be workplaces, employers, cafes, whatever. A cafe that decides to allow breastfeeding, for example, would have made that policy. I was going to use smoking as an example, but of course that's gone so much further, it's now legislation. You might even make policies at your own domestic level to say, for example, not allow your guests to smoke in your house. And this is different from strategy, of course. Strategy sets out the means for delivering that policy, that stated intent. So your policy says this is what we want to do, and a strategy document or a strategy would set out how you're going to do that. And that's one of the issues I want to get into in a minute, really, is this issue about implementation and rolling out a policy, and sometimes that can be particularly difficult. And I also want to draw the distinction between environment and policy. I think when the community guide came out and reviewed this area, I tended to think of it as a new American word that was invented called environmental policy. And it seems that environmental policy the two words were always used together. And I think there was a bit of a conflation of the two issues. And I was very interested to see that in the Lancet paper, Adrian Bauman was the lead author, that you separated out these issues, really. You looked at the socio-ecological model and said that, sure, that really the policy stuff happens outside of here. Policies are the things that influence, as I've said, environmental conditions, living and working conditions, as well as the opportunities that we have to sort of actually use the environment and make different decisions. And so, I was really pleased to see that this paper said, sure, we've got environmental influences, but policy, regional or national policies, are a range of different things that influence those, and they determine the decisions that are made. But I want to start by thinking about the national level policy. Now, for me, a European, this is mainly the level I tend to work at. I tend to be thinking about the sorts of things that can happen at national level. But for you guys, this probably means state, the equivalent is probably state level. Our countries are so small in Europe that, relatively speaking, I guess the legislation, particularly in Australia or the US, would be at state level. And the first thing that nearly always seems to happen in terms of national level policy on physical activity is this construction of guidelines. Fiona Bull led the process in the UK and was really firm in saying, we're not delivering a strategy here, we're not trying to deliver a whole new sort of range of policies. Actually, these are just guidelines. These are just quantifications of the behaviours that we think people should do. But despite that, I think what often happens is that at national level, and I suggest maybe at state level here and in the US, these guidelines seem to be it. They seem to be the policy, and actually not a great deal follows. And so I think we've been experts really at getting together these multidisciplinary consensus panels and cooking up these guidelines, and they are extremely important. But I worry that what often doesn't happen is the next bit, which is, what do we do about it? How do we turn all these guidelines into action? And I'm not that old, I haven't been working in this field for that long, but I've seen 3 iterations of national level guidelines now, from the kind of 3 sessions of 20 minutes of vigorous exercise back in the 90s, through to half an hour a day when we ran the Active for Life campaign, through to 150 minutes. And each time we put loads of effort into redoing these guidelines, and we say, right, this is how much people should do, and then all the government departments seem to just breathe a sigh of relief and think, well, that's it, job done now. But of course the job isn't done. The challenge is turning these into reality. Okay, quick quiz. This is a league table, as you can see, the highest on the left and the lowest on the right. What do you think this is a table of? What's the measure? Tea drinking, good question, good. Bulgarian tea, never had Bulgarian tea. Spanish coffee, generally. Any other guesses? Tea drinking? The correct answer, whispered, so I'm going to get some other answers first. So someone got it right there. Any other guesses? Pardon? Obesity. Obesity was what I thought people would say, and you're pretty right, we are nearly the most obese. But I don't think Bulgaria or Spain will be second. The lady in the second row got it right. This is the number of physical activity policies in the European Union member states. And the UK are the experts at this. We can churn them out. Want a policy? I can give you one. Give you one nice and cheap. Not a problem. Yeah. £4,000. It'll take you 20 days. I'll give you a policy. We just churn out these bits of paper, based on sound processes with good multidisciplinary groups and so on. And what actually happens as a result. I was quite interested to see that Bulgarians and Spanish were second and third in the league table of policies. But, I wonder if you're all thinking, well, what does it actually mean? Well, I mapped that against the Eurobarometer percentage doing regular sport or exercise. So blue bars are the same number of policies, and it's in the same order, and the red bars show the proportion of people. Not such a good correlation there, is there, really? UK experts in creating useless bits of paper, but not enormously high participation. Where are the Irish? Irish, hey, let's not bother writing too much stuff. Just go on and do it. Let's just be physically active anyway. And you would hardly expect a clear correlation between just the number of policies that are found at a national level. But I thought it was interesting to see the really clear disparity between kind of policy action and the response in terms of behaviour, the sort of behaviours that we actually want to see in the population. And so you sort of look at this and you begin to wonder, well, do we need to carry on dishing out these national policies, or do we need to focus more on implementation? So you can see that this is a map of the same data, and it shows that there's pretty universal coverage across Europe. Countries with at least one policy. And the reason why there are multiple policies are because they're in multiple settings. So there might be one on transport, one on environment, one on sport, one on education, and so on. So you can see there's kind of pretty universal coverage. But when you look at these are the Eurobarometer data again, so this is not playing exercise or sport. So the darker the colour, the higher the proportion of people who are not playing exercise and sport. And you look at this and you begin to think, well, there may be a clear number of other factors that influence the way that a country tends to take up physical activity, apart from the policy level commitment by the member state. I look at this and I think, well, is it to do with climate? Because it looks as if the southern countries, hotter generally, having higher levels of non-sport playing. Is it to do with culture? The Mediterranean countries, is it perhaps countries speaking specific languages? Is it a cultural issue? Or indeed, is it to do with the way that countries have organised their sport, physical activity and active transport policies? So, I'm being kind of slightly cynical for the sake of a laugh, but I think national policies are important, but they're clearly only an important first step in getting us on the road to showing commitment, but more importantly, seeing action on physical activity. Now, the 3 Bs, Bellew, Brown and Bauman, are not allowed to answer this next question. What is the denominator here? So 37% of whom? said that they knew the main physical activity policy messages when they were surveyed, and 48% of whom said they had used the current physical activity strategic framework, and 35% of whom said they'd used this document, which is a national evidence synthesis. Anyone know? Doctors? Practice nurses? Or public health officials? In general. I think that's got a good guess. Any other shout out? Come on, I'm not shy. Politicians. Yeah, well, I think it would be fantastic if 37%, this would be a miracle. Can you imagine if a third of all politicians, say if that's what you're saying, knew the main physical activity message? We did some research around Active for Life, and we found that when you went to the doctors, if you wanted to know the main physical activity message, you were better off asking someone in the waiting room, a general member of the public, than the doctor, because the levels of awareness in the public were far higher than among GPs. So if that was doctors, I think that would be a great success. Any other guesses? Well, it's physical activity professionals. Shame on you. These are attendees at an Australian National Physical Activity Conference. And now, doesn't that seem low? So these are the Aussie physical activity expert practitioners, people who should be putting these guidelines into practice. And only just over a third actually knew the Surgeon General's reports. Bill Bellew is going to respond in a minute, actually, so he's going to be able to defend himself. I'm not being totally unfair. Nearly half had used the strategic framework, and only about a third had used the synthesis document that I think could look to kind of evidence of effective interventions. So my point here is that, of course, we have to go on from creating these grand documents about, we must all do 150 minutes activity a week, and we have to move on to getting that into action and working in collaboration and training people to actually get those into action. And I did a sort of purposive review, if you like. We chose 3 countries as case studies, Switzerland, Finland and the UK, to look into this, to say, well, at a national level, what are the sort of stages, what sorts of things might you want to do to try to implement a national level physical activity policy and turn that into an active strategy. And we said that, sure, the first job really is to review the evidence and make the case for physical activity. So that's pulling together the evidence for the health benefits, and that's having guidelines, and that's producing your 150 minutes a week document. That's using that to thump on the health minister's desk and make the case and so on. And the task 2, we figured it was really important to find out the levels of physical activity in the population. And in actual fact, in the UK, back in the 90s, it was a survey that got us going. We ran the National Fitness Survey, and that was an incredibly important advocacy document to actually move people into action, because politicians realised for the first time how physically inactive the UK people were. But really, it's in many cases these tasks 3 and 4 that are crucial. Finding out what works in particular contexts, so sure, using international reviews of evidence, but applying it to our local or national context, and critically evaluating practice and making sure that we're actually learning as we go. So that's why policy. I hope I've sort of justified the focus on policy in general. Why should we care about evidence-based policy? You're all looking a bit too sedentary now, and I learned from Nanette Nutri this morning. I'd like you now to stand up if you would like your work or your research to influence policy. I'm watching you if you're still sitting down, okay? No, you are allowed to still remain seated. So you are all standing because you would like your work or your research in some way to influence policy. Remain standing if you think your work or research has influenced policy at some point in the past. So we had nearly everyone standing, we've got about a third sitting down. And remain standing if you've got clear evidence that you could provide to me that your work has influenced policy. Well, I'm impressed with the number still standing, because that's hard. Yeah, well done. This is the really tricky area. We all, I think it was universal. We all want, we're in this field to influence our environments, physical, social environments. We all want to do that, but actually doing it is hard, and demonstrating the impact of what we do is even harder. But it's a key principle of what we should be involved with. Sally McIntyre wrote a great piece in the BMJ saying use of robust evidence to inform public health policy is likely to ensure the greatest and most equitable population health gains. And that's why we should be doing it, because otherwise we're working more on speculation and guesstimates. If we can rely on evidence, we're much more likely to have a bigger health impact. And I've dug around a bit and found that this, certainly in the UK civil service, this notion is quite well enshrined. In the so-called Civil Service Policy Hub, they talked about evidence-based policy as being the integration of experience, judgment and expertise with the best available external evidence from systematic research. And I thought that was really interesting. So here already you've kind of got the academic perspective saying robust evidence, this is what's going to work. And then the civil service is saying, well, yeah, but there's experience as well, because I know best, because I'm a senior civil servant, and I've done all this before, and my judgment, so I can weigh it up exactly how I like, and expertise, because you can almost imagine an episode of Yes Minister with Sir Humphrey saying, well, we are the experts, Minister. And this is enshrined in civil service guidance that sure, we're looking at external evidence of systematic research, but it should be combined with experience, judgment and expertise. And that's really what I think this evidence into policy approach is all about. This is our, happily, ex-health minister, Andrew Lansley, who completely messed up our National Health Service and then left. I'm on the other side of the world, I can say that. And I was really interested, he kind of went the other way, or even further. He said our new approach across public health must meet tougher tests. We must only support effective interventions that deliver proven benefits. Now that's a tall order, isn't it? How many interventions would this government therefore be able to support if it was only effective interventions that deliver proven benefits? Not benefits with good evidence of effectiveness or benefits where the RCT has shown over control. No, proven. These are heavy words. And I was surprised to see that this had reached, at least in UK, government policy. And so it already seems as if there's quite a tension between, around the type and level and quality of evidence that should be used to inform decisions. The opposing voice I found there are quite a number of examples, but I thought this was a very interesting one from Professor Keith Humphreys, who said, it's a worthy goal, but value-free evidence-based policy is a wrong-headed concept, and to the extent that it allows political agendas to hide behind scientific credentials, it can also be dangerous. This article was entitled something like, Why Evidence-Based Medicine, Thank Goodness, is a Bad Idea. So evidence-based public health, thank goodness, is a bad idea. And he pointed out that you can kind of twist the evidence any way you like, and that without value judgments, evidence-based policy is almost worthless. And he used the example of addiction and said that we can demonstrate, using pretty good evidence, that the rates of cigarette and alcohol addiction, the risk of cigarette and alcohol addiction is highest among teenagers. And so drug and alcohol and cigarette companies are perfectly justified to target teenage children with cigarette and alcohol advertising, because they're just doing evidence-based policy. And if you think about it that way, that almost meets the health minister's criteria, proven evidence. But of course, our value judgments would say that's wrong, and we would oppose that type of marketing. And so clearly we need to combine strong, clear use of evidence with some sort of value judgments and consideration of the other consequences of our actions. So second section is to think about how evidence has been used to inform policy previously. And I've got to say that in general, I'm afraid to say that my feeling is that evidence in general is cherry-picked to inform evidence-based policy. You're probably familiar with the notion of cherry-picking, where people simply choose the type of evidence that fits their story best. And this leads to two types of bias, or at least two types of bias. hand on heart, think to yourself, say that you've never done this. Say that you've never chosen or agreed with a piece of evidence that confirms your existing beliefs. You say, oh, you know, I particularly like that study because I've always thought that that was true. And so you like that study, but you don't really think. And then this one, you start to question the methods. Oh yeah, but the sample size is a bit small. And P was only 0.42. And this is confirming the bias that you already have. And this is a real risk that we run in reviewing evidence to feed into policy. And the second, I learned this from the extremely erudite source of Wikipedia, the backfire effect. So this is where hearing evidence that opposes your view can actually make you even more entrenched in your existing view. So you hear, you're presented with a study or a trial that shows a different finding from the one you're used to, and it makes you even more believe in the approach that you're keen on. And I think we're frequently, or policymakers are frequently guilty of choosing and using evidence according to the way that they want to, and according to fitting into the policy aims they have, rather than necessarily being based on the best available evidence. And I'm going to give an example from an extremely important document in the UK. It was our national, as it says, Strategy for Public Health in England, Healthy Lives, Healthy People. And there's a really good analysis of this done by a team, a London-based team, published in the British Medical Journal. And they analysed this document. They read it from cover to cover and analysed all the policy recommendations that had been made in this new public health strategy. And they gave, they looked at each element, so for instance, family intervention projects, and they gave it either a 0 for no evidence, or a plus or a double plus for good evidence, or a minus for evidence against that intervention, evidence to show that intervention was ineffective. So on the physical activity side, for instance, cycle demonstration towns, there seemed to be very good evidence for the implementation of those, and this supported the document. And interventions to promote this thing called Step to Get, there seemed to be evidence that wouldn't work. And the sum total of that is here. So across the 50-something projects or new programme policy announcements that were made in the white paper, there were only 4 for which there was strong evidence that these things were effective. So think about that. What's your take on that? A white paper, 50-something interventions or new policy announcements, and only 4 of these have actually been shown to work. Worse, there were 4 interventions in there that really shouldn't have been in there at all, because there's evidence that these things don't work. And then, of course, in the middle, we get this range of things. So some evidence that these things have been effective, and 16 interventions for which there was an absence of evidence. I must admit, when I first looked at this, I thought, this is terrible. This is absolutely appalling. This is, this white paper is based on flimsy evidence, and we're fooling ourselves. But then I looked at this area, absence of evidence, and I began to think about this. What does this actually mean? Well, this means that 16 things have been put forward for which we don't really have evidence whether these things work or not. Is that such a bad thing? So if you consider weak evidence to be enough, that way, if you look at it this way, you've got 20-something interventions that have some evidence of effectiveness, and 16 things that are being tried, and we don't really know whether they work or not. And maybe at this current state of our evidence base, maybe that's appropriate, because we're innovating and trying out new approaches. And I wanted to just look very briefly at this idea of absence of evidence. And apologies if you've seen this earlier today, when Ross Brownson referred to this fantastic parachute study in the British Medical Journal, where they looked at Smith and Co. in one of these sort of Christmas comedy editions of the BMJ, looked at parachute use to prevent death and major trauma relating to gravitational challenge. And they basically said no RCT evidence has been found to support the use of parachutes preventing death when exiting a plane at high altitudes. And so the most radical protagonists of evidence-based medicine should organise and participate in a double-blind, randomised, placebo-controlled crossover trial of the parachute. So, so if you only believe in RCTs, then we're going to put you in the control group. Well, we're going to somehow make sure you end up in the control group and shove you out with an empty backpack. And of course, this makes the point that there are some things that we really don't need to evaluate. Some things that are so obvious that they work, we don't need to conduct RCT level evidence. But there's still clearly tension in the academic community about the sorts of levels of scrutiny that things should be put to, the sorts of study designs we should use. Which brings me on to, remember the title? I remember the title now. This notion of the emperor's new clothes. And Adrian Bauman, I think, he started this craze of considering the emperor's new clothes and how that relates to public health. And you probably know the story. The emperor wanted increasingly finer and finer gowns and silks, and until one day the tailors just completely ran out of ideas. They couldn't make the cloaks any better. So they said, oh, you know, Your Highness, how about this one? And they produced an invisible cloak. And he said, it's marvellous. And he put it on. And because he was the emperor, and as he paraded through the town, no one had the nerve to say, but Emperor, you're not wearing anything. Apart from one little kid who had the nerve to say, Emperor, you're naked. And the point about this image, I think, or this story, is that we should have the nerve to point out where policymakers are going wrong, are making bad decisions, or could improve or enhance their decision making. It's our responsibility as public health professionals to point out when the emperor has no clothes, to point out and to use our best evidence-based practice to demonstrate what's going on. And I've got a few examples of that to try to continue to explore this notion of evidence-based policy. The first is the London Olympics. Anyone enjoy the Olympics? Who enjoyed watching the Olympics? I had a fantastic Olympics. Was it the most sedentary 3 weeks that you'd spent? Yeah, my sofa has worn out as a result of the London Olympics. I had a fantastic time. I'm not going to mention too much about the sponsors of the Olympics. I thought this was a nice image. Good luck to all our athletes from the official partners of London 2012. And I also won't mention this sign that I saw, actually I will mention it, this sign that I saw on the Olympic road race route, Olympic cycling weekend deals. Collection only, large pizza and 2 cans of drinks. So, you know, for most people, this was their experience of the Olympics, was you know, a bucket of Coke and a large pizza whilst watching the cycling. But I had a fantastic Olympics. This is my new hero, of course, Bradley Wiggins, winner of the Tour de France, clean winner of the Tour de France in the post-Lance Armstrong era. And then went on to win the Olympic time trial. And look at those sideburns, aren't they fantastic? The Brownlee brothers doing a fantastic job in the triathlon. I couldn't get away without showing a bit of a medal table. Oh, Australia. Oh, yeah, they're on there. 8th, yeah. So, of course, the reason I'm bringing this... actually, let's just look at some others. Oh, yeah, the cycling medal table. Pretty good. This is just cycling events. I'm very proud of that one. My favourite event. But just in case there are any Australians in the audience, I also looked at this is a great Guardian website. This is sorted by population, so you push us off the league table there. I think the UK is way down the list, a middle table. But of course, the reason I mention this is because the London Olympics was specifically bid for and won as being about participation in physical activity. Our main promise of winning the Olympic bid was to leave behind an Olympic legacy, a legacy of fit and active, physically active people as a result of the Olympics. Here's what happened. So in 2002, the Department of Culture, Media and Sport, the main government department, said it would seem that hosting events is not an effective, value-for-money method of achieving either a sustained increase in mass participation or sustainable international success. So this is a government department assessing the evidence and agreeing not that there's a lack of evidence, but there's an evidence of lack. That the evidence has shown that hosting events like this is not an effective value-for-money method of achieving international success. And yet, that's 2002. 3 years later, then Prime Minister said, our vision is to see millions more young people in Britain across the world participating in sport, improving their own lives as a result of that participation. London has the power to make that happen. You know, we won the Olympics for many reasons, but one of the main reasons was the notion that hosting a major event and the razzmatazz and the so-called festival effect, and as I've said, I loved it, it was a fantastic event, but the notion was that this would trickle down to the population. And yet, the evidence has shown in the past that's not the case. A couple of authors of the bottom article are in the audience, and a number of other studies have time and time again looked at the evidence from previous games and shown that this is unlikely to happen. So this is an evidence of absence. And, I think we need to ask ourselves, what would we have advised, if we were Sir Humphrey, if we were civil service advising ministers, what would we have advised them to do at this time? And I think I would have advised them not to promise an Olympic legacy unless there was the investment to really put in place programmes to deliver that legacy. And then if you do it, at least evaluate it. These are the baseline data. This is the trend in sport and physical activity that they want to see increase. And you might be able to see my PowerPoint skills are not so good. I've put in the trend line that is supposed to happen as a result of the London Olympics. How are flat trends like this going to be influenced by a one-off programme and a number of disconnected initiatives that follow through and for which there's insufficient investment to actually boost participation. And what we're seeing now are all sorts of claims. To be fair, we haven't got the full evaluation from the Olympic Legacy Programme, but the sorts of claims that are coming out are really, I think, clutching at straws. So this was a local government association survey. Councils have had to draft in extra lifeguards, coaches and leisure centre staff to manage a surge in demand from Olympic-enthused residents. And I looked into this in a bit more detail because I'm a sort of troublemaker like that. And the survey was terrible. This is a survey of sports development officers, so relatively junior people in the local authority. And it was asking them, can you remember last year? Compared to last year, do you think there are more people this year or not? Totally leading question. Poor son, have you noticed an increase in the number of users compared to over the Olympic period? Remember the Olympic period, that really nice? Yeah. I think it was a 23% response rate, and the confidence intervals overlap anyway. These are the sorts of things we're beginning to see now to justify £8.4 billion investment in the Olympic programme and 101% overspend. Now I'd like to be proven wrong. I'd really love there to be an Olympic legacy across the UK as a result of the Olympic Games. But I think based on the evidence we're seeing, and certainly based on the evidence we've seen in the past, it's not going to happen. And I think we have to ask ourselves, as public health advocates, are we prepared to stand up and say the emperor's got new clothes, and are we prepared to challenge this sort of thing? Second example I want to go through is exercise on referral. So these are the sorts of schemes where patients see a doctor and are referred to a gym or exercise facility for some sort of exercise programme. And in the UK at least, I don't know if it's the same here, but in the UK at least, these have generally been led by sport. So gym owners or local authorities wanting more use of off-peak time in their leisure centres have thought, well, where can we get new customers from? And they've gone to the GP and set up a system so the general practitioner, the doctor, sends those patients to the gym and they are put through a programme. And time again, I think the reviews have shown that this approach, particularly the sport or leisure centre-led approach to exercise referral, just is not working. And yet, almost universally implemented across the UK. Excellent review in Journal of Epidemiology and Community Health. And as I said, basically we've got almost universal coverage now of exercise referral schemes. So every local authority in the UK has one, that we can't even do a controlled evaluation anymore because there are no control groups left. And yet these things are showing really quite poor evidence of effectiveness in general. And yet, as usual, of course, it's not just that simple. And this is where I think our public health skills in terms of interpreting evidence really need to be brought to the fore. Because if you think about the evidence on counselling and the evidence on face-to-face interventions, that is pretty strong. And where a member of the medical team, a GP or practice nurse, can refer someone to a counsellor who takes a patient-centred motivational interviewing approach to that person and talks to them about their exercise opportunity and then refers them to the most appropriate service, those things generally are effective. And so we begin to say, well, then isn't our job not just saying, oh, the emperor's got no clothes, it's rubbish, don't do exercise referral, which is kind of the easy approach to take. Actually, we have to be more sophisticated. We have to say, well, actually, if you're going to be doing these sorts of things, have you thought about, instead of referring to a gym, referring to a counsellor and so on? So our role here, I think, is to not cancel investment or say these sorts of things shouldn't happen, but to shift the type of investment that happens. And a similar issue, I think another example from the UK is lead walks, where local groups are usually volunteers, take groups of, the aim is to take groups of sedentary people on walks through the countryside or through the city. You know, what could be wrong with this? You know, instinctively, it's a positive program. You can almost not question the notion of taking people on lead walks. And yet when we reviewed this for NICE a few years ago now, the evidence base was really quite poor for the effectiveness of lead walks, mainly due to the drop-off. So many people turn up initially, and then there's lots of attrition through the sample. And so when there was a randomised controlled trial, and the intention to treat analysis didn't show a difference between intervention and control. And yet other evaluations have shown slightly conflicting results, particularly when you do the more sort of qualitative process evaluations. Lots of people who take part in these schemes love them, and they think they're a positive way to enhance their health. And so again, I think our role here as public health professionals is to refine the programme, not to say the emperor's got no clothes at all and cancel it, but to refine the programme and say, well, the evidence is showing that actually if you target sedentary people properly, and if you improve your techniques to actually retain walkers, or retain participants, you can be more effective. I'm using a bit of time, so I'm going to flip through that and go to look at the last section, which is, so we've talked a bit about what policy is, what evidence-based policy is. We've looked at how evidence has been used and the kind of different ways in which evidence has been used to implement policy. But let's think about, well, okay, if we actually want to do this, if we want to influence policymakers, what sort of evidence do they actually need? And again, there have been a couple of great sessions on this in this conference already. And so I tried to think of this from the point of view, everyone know who this is? It's Sydney people? It's the Mayor of Sydney. And I thought to myself, well, let's try and imagine a local politician, in this case the Mayor of Sydney, and she's considering a new idea or a new initiative to take place across the Sydney region. Let's say it's a congestion charge, because that's one of my favourites. So charging people a certain amount to enter the central business district of Sydney in a car. What sort of thing does she need to know before she will put out the weight of her public opinion behind that intervention? Well, first of all, you know, we've discussed this quite a bit already. Does it work? And that's got to be one of the critical questions. If I do this thing, if I put this congestion charge in place, is it going to reduce traffic? Is it going to improve public health? Whatever the objectives are. Secondly, of course, can we afford it? Is it cost effective? Will I get return for my money? Will it actually be worthwhile doing financially? Thirdly, can we actually make it happen? So it's one thing to say, oh, well, it worked in London or it worked in Singapore or whatever, but can we make it happen, the implementation? And fourthly, this is the really fluffy area, what will it do for my public image? And this is critical, of course, because all the rest is informed by evidence, and perhaps one of the most important elements that politicians think about is what it's going to mean for them. Will they lose votes, or will they win popularity as a result of doing this thing? Now we said, and you know, I just don't think we know a great deal about what policymakers actually need. I think we know the type of information they want. It's got to be short and concise and plain English, and they want briefings. They don't want long documents, and they probably won't read original research papers and so on. But let's have a little look at the sort of content of the sorts of things that the Mayor might want to find about. So, you know, first of all, does it work? And, you know, I think if we are looking for investments that work or evidence-based interventions, you know, the evidence really is improving now, isn't it? 10, 20 years ago, we were scrabbling really for effective interventions. We've now got this superb paper, or set of papers in the Lancet, including this effectiveness paper. And, you know, also this great thing, you know, this is only a leaflet, this is only 4 pages, and I think actually, isn't it now distilled onto a postcard that was on your chairs? This is an incredibly useful document that says, if you want to do clear evidence-based interventions, then these are some of the things to consider. And you know, 7 things. You know, these are big things, I know. Big, you know, long. Each word is carefully crafted, and they can be interpreted in many ways. But these are investments that work. So I think we know a fair few things that work now can be rolled out. But I also think we have to think about the extent to which we're able still to innovate. And as we increase the amount of evidence-based interventions that we're doing, we should also be decreasing the amount of things that we're doing based on hunch or ideas or theory or whatever. And this is certainly something that's almost seemed to be becoming quite a bit stronger in the UK at least. House of Commons Health Select Committee said, wanton large-scale experimentation is unethical, and we want a more rigorous culture of piloting, evaluating, and using the results to inform policy. I kind of agree with that, but I think it's crucial that we still have some space to innovate as long as we evaluate as we're going. And there was a really, really interesting paper by a team based at University College London evaluating or doing a process evaluation of the UK Healthy Towns project. And the UK Healthy Towns, I think really the closest we've got, or we've had so far, to a whole systems approach to preventing obesity at town level. So each town was given a good chunk of investment to really do everything they possibly could at all different levels, from policy level through to practice, on physical activity and healthy nutrition. So we had healthy eating classes, education programs, allotments, food growing co-ops, the mobile vans, physical activity opportunities, bike lane, all that sort of thing, all kind of piled into one place. A really good effort. And guess what happened? Funding was withdrawn halfway through the programme, and insufficient money was given to evaluation. But happily what this team did was a really solid, thorough process evaluation. And what they saw was a real tension in this programme between the need to innovate and the need to evaluate. So they said that the Department of Health, the government, was saying, be creative, be exploratory, almost, you've got a clean sheet. The systems approach stuff is quite new. Do whatever you need to do. And then 6 months later, they say, oh, have you got your progress report? Have you hit your targets yet? Tell us about your inputs and outputs. And they're saying, well, hang on a minute, you told us to be creative and exploratory, and there's this tension between kind of delivery on the old-fashioned model and innovation and creativity. And I think this is something we really need to come to terms with. I think we do need to use evidence as best we can, but we need to combine that with creating evidence based on practice. And of course, this is almost a bit of a cliche now, but we need to move from or include evidence-based practice and practice-based evidence. So encouraging practical projects to evaluate themselves or working with them to evaluate them in order to improve the evidence base. This is something I've been doing a little bit of work on with the National Obesity Observatory. I did a workshop earlier today to produce these frameworks to say, if you're going to do a local level project on physical activity or diet and nutrition, these are the sorts of measures you should be taking. Editorial analysis. Evaluation costs money. It's time the global health community enhanced rather than evaded this message. And I think it's said better by the great guru, who also likes to cycle up hills, one-handed in a very dangerous manner. So do good impact evaluations often. Do good process evaluations always. And I think that's really sage advice. Particularly for local level projects, they may not always be able to do impact evaluations. They probably can't have control groups. They may not even be able to use validated tools and so on. But they should always be doing process evaluations to measure what's done. Third point is that the mayor needs to know, is it cost effective? And I think we're making great strides in that. They're trying to look at the costs and implications of what we actually do. And I think here there's a lot of movement, lots of development, and I think we need to think carefully about the sort of economic advice that people need. So for the health world, it may well be the kind of weird, difficult to understand concept of a cost per quality, where physical activity does extremely well, but the health people are used to this. Again, they like it because you can compare really quite different interventions. For the transport community, it's probably benefit-cost ratio. And this is what we found for the cycling demonstration town project. Because the transport people just love the simplicity of being able to say, if I weigh up my benefits and my costs, I see the benefits are at least 2.6 times the costs. And this is the sort of thing that the World Health Organization HEAT tool, the Health Economic Assessment tool, helps you to do, is add a cost to things for transport. And we got a lot of traction at a local level in London by doing this sort of analysis. So Charlie Foster calculated, using the health service here in England, the cost of physical inactivity per region, and said that in London this was $22 per person. And then we compared it with what was actually being spent on physical activity at a strategic level, and it was $1.33. And that mismatch, for $22 to $1.33, it makes you begin to think that investment is not adequate. So I really think we need to tailor these things. And the third point is a really tricky one. I think this is a critical area. How can we make it happen? I told you there were more gratuitous rubbish bike lane pictures. What's happened here? This is a bike lane with, I lost count after 10, something like 10 cyclist dismount signs. What's happened here? What has gone wrong with this stupid bit of infrastructure? You just wouldn't cycle along here, would you? Well, Nanette says, is it Nanette? She just ignore the signs, she'd keep going. And typically in the UK, if we see a cyclist dismount sign, we just ignore it typically. But what's happened? Well, you get some clues here. There's a little footpath here and a little footpath there. For some reason, there are lots of little footpaths. So some transport planner, God bless him, has read the guidance, and it says, paragraph 3, subsection 2, whenever a footpath crosses a bike lane, you need to put a cyclist dismount sign. So the trouble here is not the policy, but the implementation of the policy. And I think this is a critical area that we really need to get to grips with, this translation of policy into practice. And this is something Steve Allender was mentioned in another seminar. I worked with Steve in the UK, and it's really interesting that he's also done a very similar project in Australia. In the UK, we field tested guidance on physical activity policies and found all sorts of barriers and problems and difficulties with translating the evidence into practice. And what I felt was really interesting was to find, Steve was involved in this study in Australia, finding really similar issues. It's one thing to have a policy on footpaths and bike lanes and creating an environment for physical activity. It's another thing to actually get it into practice because of the real barriers that happen. And final area, when thinking about what sort of evidence we need, is this really difficult to measure area. How do we get involved with the politics, the big P issues about policy? Will people like the policy? I may have the best evidence, I may be shown it's cost effective, but what will it actually do for my voters? And I think one good example of this is the London congestion charge, where a universally disliked scheme was mooted, and the papers were all against it. And yet when it was finally implemented by a mayor who had the vision to say, I actually don't really care whether people want it or not, I have the commitment that this thing's going to make a difference, we saw a massive decrease in car travel and a corresponding increase in bike travel. So, final point is I think we need to be thinking about particularly what Bill Cole said yesterday about the obesogenic or inactive system in which we live, and taking a systems approach to this issue. We clearly need to do it, thinking really carefully about the needs of policymakers. We need to be using the best available evidence, but not just the highest quality, not necessarily the randomised controlled trial evidence, but the most appropriate evidence that's going to make a difference to understanding how that policy can be rolled out. We need to innovate, I think, as long as we evaluate as we're going. We can't just innovate in a vacuum and expect things to work. We need to create evidence, so use the best evidence, but also create practice-based evidence. And crucially, we need to create the sort of evidence that's policymaker-friendly and policymakers will actually want to use. And this is the only way I think we're going to get out of the fat lane and into the fast lane. Thank you.